Welcome to the Paediatric Pan-London Oxygen Group webinar on home oxygen awareness in an educational setting. Paediatric Pan-London Oxygen Group is a group of paediatric nurses who have come together in London to bring their knowledge and experience and set standard guidelines that will ensure the management of children on oxygen therapy is safe and uniform within the London region and beyond. Today, in this webinar, these are the areas that we will cover. An introduction, the aims and objectives, legal responsibilities and duties, rationale for supplemental oxygen, roles and responsibilities of clinical and non-clinical staff, risk assessment, oxygen equipment, key safety points, and maintenance. This presentation is supported by a policy document that has been created in readiness for this training. Children and young people will sometimes require oxygen in an educational setting. The training for this is typically provided by the healthcare team. However, school or community nursing teams may have limited learning opportunities due to the infrequent prescribing of oxygen therapy. This may limit their own understanding and experience when providing training, and it has been reported that clinicians spend a significant amount of time establishing a placement for a child, and admissions can be delayed or refused due to potential anxiety around medical conditions and the safety aspects of oxygen therapy within an educational setting. Therefore, the aims are to provide information around safe usage, storage, and administration of oxygen in the educational setting, and to support that setting with risk assessments and provide appropriate training to non-clinical staff who are responsible for the care of the child. This will ensure that the child who requires oxygen therapy is supported in the educational setting, and clinical and non-clinical staff are able to practice safe use and storage of oxygen. The criteria for success has been defined as the child in an educational environment is receiving oxygen correctly and safely. A healthcare plan is in place detailing the oxygen prescription. The educational setting will have an oxygen account with the oxygen supplier that is dedicated to the educational setting. The training is provided for all staff who are identified through the healthcare plan. The educational setting follows the safety guidelines, and that all staff are confident in their abilities to care for the child and feel supported by clinical staff. The child or young person is escorted to the educational setting safely, if that is appropriate, and systems in place for transportation with oxygen. The fire rescue services is alerted when oxygen is at the educational setting and are able to provide additional support. The educational setting notifies their building insurance that oxygen is stored on the premises. The healthcare plan is reviewed annually or sooner if appropriate, and the children in the class are prepared about the child with oxygen. Legal responsibilities and duties. The Department of Education has a document, the Supporting Pupils with Medical Conditions Policy, which contains statutory guidance and non-statutory advice that highlights pupils with medical conditions should be properly supported to enable full access to education, including school trips and physical education, and that governing bodies must ensure arrangements are in place to ensure that the needs of the children with medical condition are properly understood and effectively supported. Special education needs and healthcare plans. Some children and young people will have a special educational needs healthcare plan. This calls for special educational provisions to be made for them, and they should have this plan in place. Healthcare plans ensure medical conditions can be safely supported by those caring for them. It is typically written in partnership with the educational setting, with clinical staff and the families. This identifies medical conditions and actions to follow and review, and all staff should be familiar with the plan. In relation to oxygen, these plans will state the flow rate, duration, and the interface. And within the plan, an agreement will be documented. Records must be maintained and kept up to date. Rationale for supplemental oxygen. Supplemental oxygen therapy is a treatment for those affected by low levels of oxygen in the bloodstream. Providing supplemental oxygen helps to correct the oxygen levels. Supplemental oxygen is greater concentration than that in the ambient air. Supplemental oxygen therapy is a medicinal product and is therefore subjected to medicines management protocols as well as health and safety precautions. It is essential for the key person to be fully informed of the child or young person's clinical condition and has knowledge how to respond to changes in their clinical condition. The flow rate, litres per minute, or duration, minutes or hours per day, will be predetermined by a healthcare professional following a clinical assessment. The flow rate and duration cannot be altered without further assessment or instructions from a healthcare professional. Any changes to a prescription must be supported with a new HOOF. A HOOF is a home oxygen order form. If a variable flow rate is prescribed, this has to be done from the outset. Oxygen is prescribed on an individual basis and therefore cannot be shared with anyone else, even in the event of an emergency situation. Oxygen can be detrimental in some individuals who are oxygen sensitive. Oxygen in an educational setting. So children or young person who brings their own oxygen supply from home can do so. However, they may encounter the following issues. There may be administration errors to their home account. The fire rescue services may not be alerted at the presence of oxygen. Compromised safety due to lack of training for non-clinical staff in an educational setting. No formal oxygen risk assessment performed. And uncertainty over safety and storage. Therefore, best practice dictates that a dedicated account at the educational setting is created with the oxygen supplier. The healthcare professional is responsible for creating this account and therefore ensures that the child or young person's own home supply is not depleted. This ensures that the educational setting has control over the safety, storage and usage of the oxygen equipment, and the supplier will be able to carry out 6 monthly maintenance and risk assessments. The educational setting can manage their own replenishments and record keeping. The fire rescue services are automatically alerted of the presence of oxygen on the premises by the supplier, and they can also support them with risk management. If a child, however, brings oxygen from a home account, it's imperative that when they come to the school and uses, if a child who brings their home oxygen cylinders to the educational setting and there is an account at the educational setting, the following steps should be taken. They should swap over the school supply on arrival and vice versa at the end of the day. A dedicated person should oversee this process and regard the oxygen as a drug and kept in a locked, well-ventilated room. All oxygen equipment have a unique barcode that identifies the count to which it belongs, as this is scanned by the oxygen supplier's technician. It is therefore important to ensure that the equipment is returned to the correct account. The labelling of equipment will help reduce any errors. The roles and responsibilities of clinical and non-clinical staff. Clinical staff's responsibilities include notifying the educational setting when a child or young person has been identified as requiring oxygen therapy, liaising locally with lead clinicians, and ensuring that the child or young person has an up-to-date healthcare plan and contribute to the educational healthcare plan if necessary. They are also responsible for making adjustments to the account and arranging the secondary supply, and providing appropriate training to the non-clinical staff. The roles and responsibilities of non-clinical staff is to undertake training to achieve the necessary competencies for supporting the child, ensuring appropriate steps to support the child with a medical condition, administering the medication as prescription, knowing how to respond when the child or young person with a medical condition requires medical attention, and record keeping. Risk assessment. Oxygen is safe when used in the correct way. However, when combined with heat and fuel, oxygen supports combustion. Oxygen increases the speed at which things burn once a fire starts. Therefore, it is imperative to adhere to the health and safety requirements when will ensure oxygen is used in a safe manner. The handling of oxygen is in accordance with the requirements of the Medicines Act, Misuse of Drugs Act, and the Standards for Medicines Administration. The oxygen supplier also carry out risk assessment, and this is done at installation and at every 6 months. The field-based risk assessment, or the FBRA, is completed every 6 months, ensuring there's a smoking check, smoke alarm check, storage, and non-clinical staff understanding of the equipment. The key points are safe position of the equipment, that is more than 3 meters from an open flame, more than 1.5 meters from electrical equipment and heat sources. Safe power outlets, sockets are checked for a concentrator, and the technician also measures and cuts only the length of tubing that is required in order to mitigate tripping risks as much as practical. The maximum tubing length is 15 meters from nozzle to nose. However, this can be adjusted accordingly, and if changes need to be made, they need to be done by the oxygen supplier. The field-based risk assessment also includes discussing the rules on no smoking and ignition sources. So in an educational setting, this could be in a cooking environment when using ovens or Bunsen burners in a chemistry lab. Oxygen equipment. Supplemental oxygen is delivered either in a cylinder or drawn from the atmosphere through a machine called a concentrator. Cylinders, there are several different types of static and portable cylinders. They all look very similar to each other, but deliver a range of flow rates. A regulator is sometimes attached to a cylinder, which enables lower oxygen flow rates to be delivered. If this presentation is shared with you, if you click on to each of the images, you will be able to link to a YouTube demonstration on how to use each of the pieces of equipment. Oxygen concentrators. Concentrators are sometimes used in school environments as well. Concentrators use electricity to draw air through the inlet, passing a filter that removes dust. The air is compressed before it passes through a chamber, removing nitrogen but allowing the oxygen to pass through. Oxygen is collected in the product tank where it is concentrated to a high purity before being pumped down the tubing at the prescribed flow rate. And all concentrators work in this way. Patients who have a concentrator are provided with 8 hours of oxygen in the event of a power cut and machine faults in a compressed gas cylinder. This needs to be stored safely. For safety reasons, the concentrator should always be switched off when not in use. Again, if you would like a tutorial on each of the pieces of equipment, you can ask your clinician to share this webinar with you, and you'll be able to click on to see the different tutorials for each of the concentrators. So we come to the key safety points. Fire risk materials will become saturated or enriched with oxygen and may burn very quickly and fiercely if they catch fire. Therefore, it's important you never smoke or let anyone smoke near you while you're using your oxygen equipment. Never use the oxygen equipment within 3 meters open fires or naked flames. Never store oxygen equipment close to paints, oils, grease, or any domestic heating gases. Never keep combustible materials near oxygen equipment, such as newspapers, magazines, or other items that may burn easily. And always wash your hands before handling the equipment to ensure there's no grease is present on the hands. Always follow the advice that has been given to you by the oxygen supplier about the safest place to store and use your oxygen equipment. Always ensure oxygen equipment is stored in a well-ventilated area, kept clean, dry, and away from any sources of heat. Always store oxygen concentrators upright, plug them directly into the mains, and do not use an extension lead. It is advisable to keep backup cylinders and cylinders not in use in a locked room. Wear appropriate signage, easily accessible when required. Always check the oxygen is reaching the patient. Always turn off the oxygen equipment when not in use. Always check the gauge to ensure there is sufficient oxygen. Check the expiry dates of the oxygen cylinders on a regular basis. Never alter the length of the tubing. Be aware that tubing can be a potential trip hazard in the classroom. Take care of any tubing lying on the floor and make sure it doesn't become trapped, tangled, or kinked. And never use any petroleum-based products such as Vaseline to smooth on sore areas around the nose and mouth when using oxygen equipment. Please discuss with the clinical team with regards to alternative products. Always place statutory hazard notices in an area where oxygen is stored. This includes all the areas where the child receives lessons. Always inform emergency service personnel about oxygen cylinder storage areas in the event of a fire alarm or fire. Always ensure you're only using oxygen equipment for the named patient or person. It might be advisable to label individual equipment if more than one child is using oxygen in the educational setting. And always ensure that oxygen is given in line with the prescription, that is to say, litres per minute and hours per day. Maintenance. Cleaning and hygiene. The concentrator filter, a sponge, which is at the back of the concentrator, should be washed and cleaned at least once a week. The sponge should be dried on a should not be dried on a radiator, as this will cause the sponge to shrink. The nasal cannula should be changed at least once a month, more often if it becomes contaminated. Repairs. Should the oxygen equipment fail for any reason, switch the backup cylinder and call the customer helpline for the oxygen supplier. Never attempt to repair or modify any faults or attach any equipment not supplied by the oxygen supplier. Advice and support relating to oxygen administration can be obtained from your healthcare professional who prescribed the oxygen. The oxygen supplier, Air Liquide, is available 24 hours a day, 7 days a week to provide advice on the use of oxygen equipment. Thank you for listening. Paediatric Pan London Oxygen Group have many other resources. This includes the management of child on home oxygen. This is the discharge bundle, guidelines for home oxygen weaning in the community, and a document on transition from paediatric services to adult services. You can find PLOG on Facebook and Twitter. And if you're an oxygen prescriber in London, you can go to the Air Liquide portal to access more information. Thank you for listening.